Hi, everyone. We'll just give it a few minutes to start. People are making their way into the main room. We'll give it another minute and then just get started with introductions to give our speaker the maximum time and some time for questions. So I'll go ahead and get started, at least just with our introduction. Good afternoon and welcome everyone to our MCPAP for Moms quarterly webinar. I'm Lena Mattal and I'm the Associate Medical Director for MCPAP for Moms and a perinatal psychiatrist based at the Brigham and Women's Hospital. Today's topic is motherhood in a pandemic, findings from the perinatal experiences and COVID-19 effects study. And our speaker is Dr. Cindy Liu. Just a few housekeeping items. This session will be recorded and will soon be available on our MCPAP for Moms website, www.mcpapformoms.org. And a copy of the slides, the PowerPoint slides, will also be available there. Our presenter will stop for questions throughout, but we'll also leave some time at the end for us to have a discussion and some questions. If you have a question or comment, please go ahead and just use the Q&A box. And we will either unmute you if it seems like there's some clarification needed, or we'll read the question out. You'll receive a survey at the end of this webinar, and we really appreciate your feedback, so if you wouldn't mind filling it out. And I'd like to introduce our speaker, Dr. Cindy Liu, who is an assistant professor at Harvard Medical School, director of the Developmental Risk and Cultural Resilience Program within the Departments of Pediatric, Newborn Medicine, and Psychiatry here at Brigham and Women's Hospital, and a licensed clinical psychologist. Dr. Liu's research focuses on stress and mental health within the lifespan, including the perinatal period and the relationships between parents and children. She received her degree in clinical psychology from the University of Oregon, and after completing a clinical internship at McLean and a postdoctoral fellowship at Boston Children's Hospital, served for many years as the director of multicultural research at the Commonwealth Research Center at the BI Deaconess, and is now the director of the Developmental Risk and Cultural Resilience Program here at the Brigham. And I have the privilege and good fortune of working with Dr. Liu in some ways on this data that she'll be presenting today, but also in many other ways. And I'm just really excited to share my privilege with all of you, because she is a wonderful speaker and a great colleague. Please, again, just a reminder, if you have questions, just use the Q&A function. And Dr. Liu, please.
Thank you so much for that warm welcome. I'm going to go ahead and share my screen, and it'll take a few seconds for it to load, so bear with me. All right, I'm just gonna put this into screen. All right, so thank you everyone for joining us during your lunch hour. I have the real privilege of being able to share some data that we've been collecting during the pandemic on women who are expecting to have a baby, or those who have already had a baby in the past 6 months. So we've titled this presentation, Motherhood in a Pandemic, findings from the PEACE study, which stands for Perinatal Experiences and COVID-19 Effects. I have no disclosures to disclose, and thought we would just recap a bit on the pandemic. And I know many of you see patients who are affected by this. All of us are affected by it. And early on, as we thought about pregnancy, much of the discussion was on how it could be passed on to babies, how it could affect the physical health of women. And subsequently, people started to realize that this is really having a toll on mental health. And so there are more pieces focused on mental health and the mental health of those who are the most vulnerable, including pregnant women and those who had just given birth. So this is not necessarily new news to you, but this was something that we had wondered about in terms of sort of the reach of the pandemic in the lives of women. And when we set up the study back in May, there was really very little information about the psychosocial experiences and the mental health symptoms that they were experiencing. So I banded together with my colleagues, Dr. Lena Mattel, who's in the psychiatry department at the Brigham, as well as Dr. Carmina Erde, who is a neonatologist from newborn medicine. And we came together to think about how we could best capture the varied experiences among women as the pandemic was really starting to ramp up. And so what I'm going to be talking about today are the various analyses that I've conducted on this data set, some of which have been published, some of which are under review. But this study took place we started in May. It's still ongoing. It's a nationwide survey where we've asked women to complete a number of questions about their pregnancy, about their postpartum experiences, with a specific focus on psychosocial experiences and mental health. And the goal really is to understand how stress, well-being, resilience, social support, all these things that have sort of gotten disrupted, what that has been like for those during this particular period in their life. And we've recruited, I would say at this point, over 2,000 women to participate. And as I'll share a bit more towards the end, we're also working on following up with those who've agreed to continue with our study. So what did we find? Well, the first thing we looked at were the mental health rates. And this is data that's already out and published. What we found was that about 1 out of 3 women scored above the clinical threshold for depression, 1 out of 5 above the threshold for anxiety, and about 1 out of 10 scored above the threshold for PTSD. So these are pretty high rates. They're slightly higher than the population level data that we know of with this population. And this may be due in part to our sampling strategy, which is not a population level sort of approach. And I do acknowledge too that the large majority of the sample is comprised of white women and those who are pretty educated. But nonetheless, we can sort of answer some questions about their experiences and just sort of what has produced these symptoms. We also acknowledge too that in our sample, we had a good number of individuals who already had a pre-existing mental health diagnosis. So the rates are pretty high here, though perhaps not surprising to this audience here. But it gives us an opportunity to look at sort of differences between those who have a pre-existing mental health diagnosis and those who don't, and to what extent do they experience problems during this time. Another component to the pandemic that hasn't really gotten a ton of attention is the experiences of grief. And there's actually not a lot of papers on this at this point, not a lot of academic empirical papers, but in the lay publications, we do see some mention of how those who are preparing for pregnancy, who are sort of perhaps excited and getting ready for this major milestone, that they're not getting sort of what they expected. This was not what they had imagined their pregnancy to be or what parenthood would be. And we know that sort of the unmet expectations are a really major contribution to mental health concerns. So acknowledgement of grief, I think, is critical, especially in light of sort of the things that we saw in our data. So we had an open field where we asked people to share about whatever they wanted us to know about their pregnancy. or their post-partum experience. And here we see a couple of mentions about grief. The biggest emotional adjustment in my postpartum experience has been letting go of the expectations I had for my baby's first year. I feel a kind of grief for the loss of those things. Here we have another individual saying that the pandemic has taken a lot of joy out of having a child and that they're really resentful of that. Or another woman mentions being robbed of the experience of being pregnant. So the question is, with the sharing, could we quantify grief? Could we quantify other COVID-related concerns? And we included a number of items on our survey to assess that. And this COVID-19 related grief is comprised of items from other grief measures, as well as the ones that we developed specifically assess the impact of COVID. And we also assessed the extent to which they've been worried about COVID itself, whether or not they were worried about being infected, whether or not their health was being influenced by COVID. And what we see is that these COVID-related concerns have been reported in a good number of individuals. So almost 1 out of 5 women reported being really worried about health related to COVID, and that about 8 to 9% of women reported having relatively high levels of grief. So do these worries about COVID play a role on mental health symptoms? And the answer is yes, they do. So if you see here, those who indicated higher levels of grief were 4 to 5 times more likely scoring above the threshold for depression, anxiety, and PTSD. And we also see too that individuals who are a bit worried about the health, whether or not COVID they might be infected by COVID and so forth, that too also had association, or it predicted these mental health symptoms. And this was also, we also took into account pre-existing mental health history, other sociodemographic characteristics. And so regardless of whether or not you have a diagnosis, COVID appears to predict elevated mental health symptoms. I'm going to switch gears just for a moment and talk about what it's like to be pregnant and what it's like to receive care, right? I think prenatal care is such a huge component in one's not just getting care, but just one's preparation for parenthood. It's a milestone each time you go in. It's something that I think really changes your preparation for being a parent, as a caregiver. And so we asked questions about what that was like for women who were pregnant. And we know that there was that major transition to virtual care. So we asked what types of changes took place as a result of COVID. And here we see that many women transitioned from in-person visits to virtual visits. The format of prenatal care was changed for the large majority of women, as well as the cancellation or reduction of these prenatal visits. For most, they could not take part in the hospital tours, which I know is really kind of an important part of getting ready to give birth. And that we see here that if we add up just the number of changes that the majority of women indicate having sort of this disruption, 3 to 4 disruptions. Does this affect the way that they think about prenatal care or how satisfied they are? I'll get there in just a moment, but I'll say that in general, most are moderately to extremely satisfied. So satisfaction seems to be okay, but are they associated, are these changes associated with that satisfaction of virtual care? And what we see here is these interesting results. Prenatal care changes due to COVID themselves, when you look at just the number of changes, appear to reduce the satisfaction of their prenatal care experience. Now, satisfaction is only one metric. There are many other metrics to consider when it comes to health outcomes, but this one is sort of one that we wanted to hone in on, given the fact that that experience has been so critical for people as they prepare for having a baby. We also asked what are some of the other concerns that take place during pregnancy, particularly those that involve more psychosocial oriented experiences. And here we found that, as you can see, the percentages of these particular items, we see here that a third of the women report, well, let me see here, 2/3 report feeling particularly stressed about going to the hospital because of COVID. Now, if you remember, earlier on, there was a lot of confusion about what would take place when you got to the hospital. And so definitely these results reflect that. We also see that almost half report that they were worried about trying to get to the hospital, or what would happen if their baby became sick and they needed to see a doctor. And then 1/3, interestingly enough, reported that they were worried that the COVID-19 related stress would affect their ability to bond with their baby. And I'm gonna come back to this particular item. But what you see here is just a host of worries and concerns that are affecting women who are pregnant. And who are these women who report these higher levels of pregnancy-related stress? We see that those who have higher levels of generalized anxiety, they are more likely to report this. And of course, that doesn't seem like a huge surprise. Those who who are more anxious are going to report being more worried about their pregnancy. We also see too that individuals who have a harder time tolerating distress also report this type of COVID-related prenatal distress. And what I wanted to say here is that I have a column here that looks at COVID-19 specific prenatal stress as an outcome, but if you look to the right, there's general prenatal distress as an outcome. And those items refer to experiences such as being concerned about sort of the physiological experiences of pregnancy. You can ask this during non-COVID times, right? Just sort of the distress around the pregnancy. And you see a couple of differences in terms of what predicts each of these respective distress. But a commonality really is that distress tolerance, the generalized anxiety and the distress tolerance being predictors of how they report their distress overall. So coming back to those concerns among pregnant women, I'd mentioned this 1 out of 3 women worried about their ability to bond with their baby, that COVID might be disrupting that process. And that's sort of an interesting and surprising item. And we were curious about that. What exactly was that experience? And we looked at the qualitative data to get a better sense of that. And what we find is that women mentioned items such as this: I was having great difficulty bonding with my baby because I kept thinking one or both of us would die soon, so it's not worth it to get attached. Another woman reported, my inconsolable crying has resolved, but I do feel a bit of a disconnect from my baby. I feel as though the attention I give to her is different than what I had experienced with my first. And then finally, the pregnancy feels less real for my partner, and it creates a lot of anxiety and sadness for me not having him there for our first. I think this makes us both less connected to the baby. And so, as you can see, these women are describing difficulty bonding, and there were worries during pregnancy about whether this would happen. And when we look at individuals who already gave birth, they do report some struggles with this. Now, a question is, are they the same people? And that's something that we will be able to look at with our follow-up data. But what we see now is that pregnant women appear to be worried about bonding. And in the postpartum, we're seeing women who are reporting this. Again, we don't know if it's linked, but we do see this occurring. So then in looking at the postpartum women, we wanted to get a better sense, okay, who are they exactly? If we can't if we don't have data to indicate that that's what they were worried about during pregnancy, can we at least look at some other characteristics that might describe more about who they are? And we draw from the literature on postpartum depression and depressive symptoms, knowing that that has been associated with lower quality maternal infant bonding. We also know too that prenatal and postpartum anxiety interfere with sensitive maternal caregiving. Interestingly enough, it's different than postpartum depression. The literature is mixed with regards to whether or not anxiety is at all associated with maternal infant bonding. So while it seems to perhaps be related to the sensitivity, not sure about the bonding, whether or not you can foster that emotional connection with your baby. And then there's some other constructs that we were curious about in light of the pandemic. So for instance, social support. We know that that is so crucial for so many outcomes. To what extent does that protect maternal bonding, especially with social support being disrupted during this time? And then we thought about self-efficacy too, which is really confidence in your caregiving. To what extent might that be protective in fostering maternal bonding? So what do we find? We find that individuals who have elevated depression are at more risk for poor maternal bonding. We see that those who are more confident in their caregiving, they appear to have higher quality maternal bonding. And then COVID. What has COVID done in terms of how people think about their bonding with their babies? Those who experience grief are less likely to less likely are able to bond with their baby. And interestingly enough, those who are worried about their health don't seem to show that. They seem to show an opposite effect, which is that they are better able to bond with their baby. And so we take into consideration the emerging research on anxiety and its relation to relationships. We know about depression in terms of anxiety. That's been somewhat mixed. We don't see that here. We do see that confidence might matter, and as well, addressing grief might be a really important piece of the puzzle as we think about addressing COVID itself. And then there's that interesting association between related health concerns and maternal bonding. And maybe the case too that those who are worried about their babies are those who feel more connected with their babies. Another question that we had, especially in light of our work with newborn medicine, is what about these vulnerable populations, including NICU parents? Has the stress about COVID exacerbated the mental health concerns among NICU mothers? And so in our data, we actually had a number of questions for those who reported having their babies hospitalized in the NICU. So we asked a bunch of questions about the environment and how stressful it was. And so there's actually a ton of data for us to sift through. What I'm going to be reporting here are just the similar items that I've already described, those pertaining to mental health, and also those related to being worried about your health. So has it exacerbated the mental health concerns among NICU mothers? And the answer is yes. So we already know that the NICU population is highly stressed. They are going through a very hard, stressful situation. And so this is already a highly stressed group. And so what we see here, if you look across the four figures, are individuals who are either NICU parents or not NICU parents, defined as whether or not their baby was admitted to the NICU, and that's the bold line. The dotted line are those whose babies were not admitted to the NICU. And across the bottom, you see individuals who were categorized based on how worried they were about COVID. Again, were they really concerned about infection, whether it was going to affect health? we had categorized them based on their report of whether or not they worried a lot or worried a little. So that's what's on the x-axis. So what we see is that for those individuals who score high on these health worries, if they are NICU parents, they appear to sort of shoot up, as you can see. Their scores for depression, anxiety, and PTSD, and also loneliness all appear to be much higher than expected, and certainly higher than the individuals who score low. And so what does this mean? When we think about NICU families, we think of them as a vulnerable group in general. But there are differences. Certainly there are parents who may be a bit more preoccupied, a bit more concerned about the health concerns, right? Their babies are medically vulnerable, but there's a pandemic, and that pandemic has major health implications. And so there may be a subset of women who just report a lot of anxiety about that. So for those individuals, we would want to sort of keep an eye on them, because it appears that they may be at more risk for these mental health symptoms relative to the NICU parents who don't necessarily show such high worries about COVID. So I've raced through my slides, but we'll hopefully have lots of time for Q&A. But first, these are some of the initial implications of this work based on our analyses. And we actually have one paper published. We have 6 that are under review, much of which I've described here. And so really this is an important time to think about what is it that we can do for the parents who have given birth during the pandemic, but also what implications, what are the implications for those, in the future? What is it that we've learned about the pandemic as a major disruption that we can sort of apply to patients in the future? So first of all, one of the major findings is in this work, as well as in some other studies that I'm involved in, is that COVID-19 related grief is a huge predictor for many outcomes. And it's something that we don't necessarily talk about. I think many of us are sort of living life day to day and trying to get through the day. But there is grief in the loss experiences. And that seems to be pretty predictive of mental health concerns across the board. Second of all, our data suggests that these disruptions to the prenatal healthcare experience may be quite salient to women. I haven't gone into, and I didn't show this data, but beyond the prenatal, the virtual prenatal care, we've also seen associations between the birth experience itself. One finding that was striking was that women who were unable to get medication at birth, and which they attributed to because of the pandemic, that also was associated with higher depression symptoms. And so the whole experience of interfacing with the healthcare system is a pretty major factor that we need to take into consideration. There's also data, not just in these studies, but in other studies, suggesting that those who have a harder time tolerating their distress are faring worse. But that's also a target for intervention too, is how can we try to help individuals to develop that tolerance and to regulate their anxiety during this time. Pregnancy distress around those concerns about the hospital, they're salient, as I've already mentioned, but also it's related to bonding. So we think about intergenerational experiences or intergenerational effects. There's certainly biological underpinnings, but when we look at our self-report data, I think about intergenerational transmission of stress when I think about how pregnancy distress might be affecting the way that one connects with their baby. And so there's some early evidence based on our work to suggest that we might want to consider dyadic interventions to help with that bonding and also to increase one's confidence so that they can provide care to their baby. In terms of next steps with our work, going along the lines of thinking about intergenerational experiences, these babies are growing, and so we are interested in the postpartum experience, and not just self-report, but also watching and seeing how the mothers and babies interact with one another. My background is in developmental psychology. Most of my research designs are observational, and so we can't bring moms and babies into the lab at this moment, so we decided to bring the lab to them. We've been conducting virtual observations that are recorded, where we ask them to take part in a couple of activities. One is the free play activity, where we simply watch the mother and the baby at home playing with one another. And then we have them do what we call the face-to-face still face, which some of you may already know about. And here it's an experimental paradigm where we ask moms to play with their baby face-to-face for 2 minutes. And then we ask them to hold a still face where they don't talk, touch, or have any expression on their face for a total of 2 minutes. And that's where we watch to see how an infant might respond to their mother. And then we ask the mom to resume, thankfully, to playing with their baby face-to-face. And we call that particular segment the recovery period, or the reunion, where the mom and the baby might reunify and try to co-regulate during this period of time to sort of reconcile over the 2 minute still face. And so there's a lot of opportunities to understand the extent to which the pandemic might be associated, or pandemic experiences might be associated with what we see from our videos. I am thankful for a number of our former lab interns who've come back to actually do these assessments. And to date, we have about 30 participants who have come back to take part in our study with their babies. And so there's more to come in terms of what we will find there. It'll take us some time to code the data, but I'm hopeful that there's going to be something there that'll really clarify the effects on both mothers and babies. And so this is our study. It's still open. We are still including people in our study. And that allows us to see how there might be any changes, of course, over the course of the pandemic period. So if you'd like more information, feel free to go onto our website. We also have updates on our research, any kind of media updates as well. These are the individuals that I want to acknowledge. Thankful to be working with Dr. Mattel, as well as Dr. Erde, our postdoc, our resident study coordinators. And this is largely unfunded, with the exception of some funds that I have at my discretion to be able to keep this work going. So they're listed there. And then if you would like any information about my other work involving stress and parenting, as well as I have some young adult data, you can go to my website as well. So that is it. I'm going to end my show now, end my slides, and I think we have ample time for Q&A.
Thank you so much, Dr. Liu, for this amazing talk. And just for all of the participants, just a reminder that you can go ahead and put into the Q&A section any questions that you have. There was one question already noted, and I'm wondering if you could just speak a little to this. It was related, and if I don't get it right, the person who asked it can certainly unmute themselves and clarify. But at one point you said that during the birth experience data that you didn't fully include, but mentioned a bit that not having access to medications was considered sort of a stress and added complexity. And so I think the person asking was just curious if you had more information about that. What were the medications that weren't made?
Yeah, yeah. So like epidural, that was one. It was basically right at birth. epidural was listed as one of the medications.
So if the person who asked that, if you want to ask a clarifying question, please feel free to unmute yourself, or we can do that for you if you're not able to, and then, or if that satisfies the question. And please, anyone else with other questions.
It's actually, let me expand on that. It's actually a really interesting question. And I didn't include this data because I had so many slides already with lots of tables, but the birth experience itself, you know, there's a lot of work on like birth trauma and so forth. And so I sort of see this question sort of around, it kind of hovers in that domain. There were a lot of surprises for people. So early on, for some, they could not see they were separated from their baby because there were concerns about them transmitting any kind of, you know, any virus to their baby. And so that, as well as there was a check mark for, were there other things that happened that were unexpected during the birth? And many people checked off other. And so we looked to see, you know, what did they say? And a lot of it was that their partner couldn't be there, or their partner couldn't come in and out of the hospital during that time, as well as they couldn't find childcare. And so there was concern about giving birth alone. That was actually a really big concern. And it was those particular items that were associated with PTSD. So there's something there about not just unmet expectations, but something that, you know, something really scary could have happened during that at birth. And again, this is early on. People really just didn't know who could be at the birth and whether that could happen. And for some, that was the reality, that they could not have somebody with them. When we control for how long time has passed since they did the survey, even when you control for that, you do see this PTSD, this elevated PTSD. So sorry, didn't have that in my presentation, but I thought I would expand a bit.
I think that's actually so relevant, because really, as we on the mental health side are broadening our definitions of what trauma is and how we classify experiences as traumatic, I think this really points to elements of that. There are a few other questions. One is if participants have women who might be interested in participating, how should they be directed? Are there flyers? Yeah. If you might want to even potentially put it in the chat if you have a flyer handy, but otherwise we can distribute it to participants after, as well as the website.
Sounds good. I'm not sophisticated enough to try to figure out how to put a document on here, but we do have flyers. Thank you so much for asking, and I'll make sure to try to get it to the team here so that it can be distributed. But yeah, we'd very much like to include more participants because things do change over the course of the pandemic. So it'd be really valuable to have people take part in it.
And then the next question is whether you have suggestions for specific topics or conversations that would be helpful to address for postpartum support group to help prevent perinatal mood and anxiety disorders related to COVID-19.
Yeah, I think, you know, my take on the data as a whole is that there were a lot of experiences that happened during pregnancy that might be covered in a postpartum group, really just sort of normalizing these experiences. The thing is, they feel unusual to the individual, right? We've never had a pandemic in our generation. And so there's all this uncertainty, and it really, I think for individuals, feels so unique. It really is unique to the person. And yet so many people have experienced it. I mentioned grief as something we don't talk about a lot. It might be hard for people to talk about, by the sheer nature of that, it's emotional. On the other hand, it may be hard for people to share because everyone else has gone through it. And so, you know, if you're trying to elicit support, it might be hard because everyone else has gone through it. I know that has been mentioned before. So I think a group might benefit from normalizing what transpired during what we might call a pandemic pregnancy. It's an unusual time to have a baby. many people didn't expect having a baby during the pandemic. Now, we also hear people who are planning on having a baby during a pandemic. And so I think the circumstances for pregnancy differ so much, but at the same time, I think it's important to acknowledge the changes and sort of the unmet expectations of having a baby. As for the postpartum, I think we all know that especially early on, getting help was so challenging. You couldn't really have anyone in the house. And I think we've all sort of figured out ways to try to make to meet our needs. But, there's a lot of not just uncertainty, but guilt, right? So if you bring in a grandparent, there might be guilt if they were to contract COVID for whatever reason, or to bring it to the baby and so forth. And there was a lot of protecting other family members, but sort of at a cost to your own needs. And I think that combination of guilt, but sort of requiring support, it's really hard to juggle, especially when we tell women, you need support, you need people around you, feel free to ask for help. Well, there's risk to that. And I think we need to acknowledge that.
There's a comment that there are other efforts related to Neoquik, the Neonatal Quality Improvement Collaborative in our state, and some ongoing work on family engagement in the NICU setting. And so that's just a comment from a participant.
Yeah. Thanks. No, I've heard of the Neoquik Group, and I haven't, formally connected with them, though I know members of the group. So thank you for mentioning that. I'm glad that this work could be fitting for their initiative.
If there are other questions, please submit them. I do have one question, a little bit, just to, if you could talk a little bit about some of what you're seeing. I don't know if you're able to yet, but it just in terms of even just adapting your methods to the virtual world, especially around the parent or the caregiver and child interaction and that whole piece, because I think it's innovative. It's happening now. We're really having to all pivot what we're doing in different ways. I'm just curious if you could talk a little about that.
Yeah, no, it was actually it was a challenge. We really didn't know if we could execute this. But I knew that, in our world with developmental psych, babies cannot give you self-report. And so, but beyond that, you really do want to see people and to see how they're responding in the moment. And especially with our paradigm, you want to see how people respond to minor, what we would consider relatively, lower stressful situations. We wanted to see exactly how that transpired. So in the lab, it's a very, very controlled environment. In our lab, it's no windows. It's just a couple of chairs, a couple of video cameras, and there's no sound coming from any side of the wall. And that was the first thing that I emphasized to our team, which is, how to run studies in our lab. We have to create that lab setting in somebody's house, and not only just anyone's house. It's a house of, a family where they just gave birth, and so we really had to think through what are the disruptions that can occur and how can you convey that to the family in a positive way, in a, sort of, we need this to be controlled so that we could really analyze our data and get the right data. So we really had to balance getting the right, getting the data versus, we don't want to be like, demanding of the family in their own home. And what we found was that providing a video was the key to all this. So we produced a 3-minute video. My study coordinator never made a video before, but then learned how to do it and looked so professional and really sort of this pleasant, it had background music that was really nice and calming. And actually we liked it because our study is called the Peace Study. So we wanted something that was sort of peaceful and engaging at the same time. And so we asked participants to watch this video, and there's a huge difference between those who watch it and those who don't. Those who watch it, they have everything set up already, right? Images are so much better than just us trying to give these instructions or making somebody read an email about what is needed to create those conditions. So we find that that video is so key. And so, I think about not just experiments, because there's a lot of experiments being done with parents and children. I like to participate in them with my son, just to see how other people try to execute this virtual data collection. But, aside from research, I think, I wonder if clinically, if this could be somewhat of a tool, right? And if maybe creating a video just to give people a sense of like, how do you set things up so that we can make these observations, whether or not that would be useful. I think, that's an open question, but perhaps our work can inform that.
There's another question. Let me. So another question, are you looking at all at how COVID is impacting willingness to connect to mental health professionals via telehealth? Other support services like lactation support, and specific related to lactation support, wondering if lack of in-person support for this service could negatively impact a mom's anxiety level related to feeding.
Yeah, that's a really good question. So in our survey, which has many questions, we have a question, in fact, I have it up here. It's, are you actively involved in virtual support groups related to pregnancy and postpartum? Are you actively involved in, so we asked that question for the general group, but also for those who are NICU parents. And so we have those items, and I actually have not looked into those items in our analyses. So that's something that we will do as a next step is think about, groups. And we actually didn't ask a lot about mental health care. So that would be an omission in our survey, though in the follow-up, we hope to inquire a bit more about that, especially given the high rates that we see of those who report having a diagnosis.
In the NICU in specific, have you thought about, or in looking at some of the kind of responses, interventions that could be put in place in the NICU to make this more kind of parent friendly?
So put in what? You mean the survey or?
Oh, no. I mean, like just in terms of clinically, like what you're doing to support families, having the challenging experience of having a baby in the NICU in a pandemic.
Yeah. No, this is, well, for the audience here, both Dr. Mattel and I are trying to figure out a way to support NICU parent mental health. And we started this initiative before the pandemic, and now we're challenged with, what does the future look like? How can we help now? And what does the future look like? And so when I think about the NICU parents, I think about virtual care, that when it comes to mental health, there are, I think, sort of invaluable, the silver lining of all this is that we might be able to provide virtual support. And especially with a population where they are in and out, or they may have trouble coming into the unit, that this is something that we might be able to create more fully. I still have to think a bit more about that though.
And we're also thinking about it in terms of in our sort of growth and development of a parent mental health program specifically too. I think, it's relevant. One of our participants has their hand raised, and so we're gonna see if we can unmute her so that she can ask a little bit more.
Can you hear me?
Yeah, I can hear you.
Sorry, I got tired of typing so many questions. I'm just curious, and I don't know if you can speak to this. I guess it's more a general question for MCPAP, but I've been wondering if with, telehealth being kind of the go-to right now, if the criteria of how referrals not are made, but have that the list of therapists that come from MCPAP for moms as a service to parents. And typically my understanding is that it's based on kind of your geographic area and insurance. If with telehealth, the geographic piece is something that's still criteria, or how you're considering who's on that list, and if that's something that could expand access for patients if it wasn't.
So, I mean, I can speak to this a bit, and I think all of our resource and referral specialists and staff are considering telehealth options primarily, you know, just because that's sort of the state of the field at this point. But I part of the geography still remains relevant, because if the relationship sticks and things start to move towards in-person, we are trying to also keep geography in mind. But I do know that from hearing kind of the anecdotal piece, that our resource and referral specialists are certainly expanding the sort of radius of searches, just because telehealth is increasingly, it makes access just broader. And so I think it's sort of a kind of both and.
Mm-hmm. All right, thank you.
Absolutely. Are there other questions for Dr. Liu? So I think if there aren't other questions, I mean, I could certainly continue to chat with you forever, but we also have plenty of time to do that otherwise. But if there aren't other questions, we can certainly end a little bit early, or we can also, if you want to just put the slide back up just about the study, to make sure that folks have the information and the website, just to give one more opportunity, especially if there's interested clients or participants or patients out there.
Pretty easy website name, and I will make sure that the slides get to MCPAP for Moms for dissemination. And you know, we actually do a pretty good job keeping the website up to date. So not all websites are like that, but we actually are pretty attentive to it. So if people are curious about any facet of our work, feel free to contact me. We also have a ton of data too. As you can tell, you know, with questions that are asked, you know, I will have an item here or there about certain things. And so if there are particular questions that you think our data could actually, you know, shed light on, I'd be happy to, I would love to hear them out and to, you know, maybe delve into seeing whether or not we see that in our data. So feel free to contact me.
Dr. Liu, there's one more question actually from a member of our team, from Dr. Strauss, who is the program director for both MCPAP and MCPAP for Moms, asking if, given that it's a national study, are you seeing any regional differences?
Oh yeah, that's a great question. We haven't looked into it yet. And that is due in part to the fact that we have to scrape data. Well, we have to sort of, we have to recode our data. We do have information about what hospital they're going to give at birth at. So I think that's a really, really interesting question. Not everyone provides that, but we do have that. I will tell you that we did scrape data to look at COVID transmission rates, you know, where they're located. We did something very preliminary, and we took the information that they gave us on their location, and we found a COVID site where we scraped the data from there and then merged it with this data set. Preliminarily, we don't see any association between, you know, their location and mental health. So I guess maybe that might answer your question. It's not regional, but we just sort of looked at COVID transmission rates. But we're not done with that, because we think that there could be something there. In another data set that I have with young adults, we did not see an association between the location of college campuses and that local outbreaks in relation to mental health. So that might be, I don't know, it could be a bit of a stretch in looking at those two data points, but we're still trying to figure that out. So really good question about regional differences and what might be transpiring in different locations.
Yeah, but it sounds like there's more to see too, so. Mm-hmm. So unless there are any other last minute questions, certainly you can, for participants, if you think of another question, you can reach out to us through MCPAP for Moms, and we can get Dr. Liu to answer later and get back to you. But thank you all for participating and for your attention. And thank you so much to Dr. Liu, because this was just really, really exciting to see all of this kind of codify a lot of what we're all seeing day to day in our clinical work. So thank you so much for the great talk.
Thank you so much for having me. I'm so happy to be able to sort of share everything that we find. It's all very exciting.